Hi, good morning, everyone. I want to thank our panelists for joining us today and everybody who's joining us virtually this morning. I am Congresswoman Jennifer Wexton, and this is a healthcare town hall to talk about the Affordable Care Act and the court case that's going on right now. So we are joined by some fantastic guests today. Little Lobbyist Ambassador and Parent Tasha Nelson, Chair of Protect Our Care, Leslie Dach, Pediatric Director of Novant UVA Health, Dr. Anastasia Williams, and the Chief Executive Officer of HealthWorks, a local clinic, Carol Jameson. It's been one of my top priorities in Congress to expand access to healthcare. I'm proud that in the House we've passed legislation to reduce premiums, shore up the individual markets, defend protections for pre-existing conditions, and lower the cost of prescription drugs. But unfortunately, we're also playing defense. Less than a month from now, the Supreme Court will hear a case that could determine the fate of the Affordable Care Act, which has provided more than 20 million Americans with affordable health care and protects more than 3.5 million Virginians who live with pre-existing conditions. It could also mean the ban to the end on lifetime caps, to parity for mental health care, and to Medicaid expansion, which has brought coverage to more than 400,000 Virginians. So now more than ever, access to quality, affordable health care is crucial for Virginia families as we continue to battle COVID-19. The pandemic has exposed gaps in our healthcare system and underscored not just how critical the ACA is, but also the importance of building on the ACA to get more Americans covered. Here in Virginia, approximately 92,000 people have enrolled in Medicaid just since the advent of COVID, and that's thanks to the expansion that we passed during my time in the state Senate. Thanks to Medicaid expansion and the ACA, we're able to protect more Virginia families during this pandemic. World Mental Health Day was just this past weekend, and the ACA has made mental health care significantly more accessible, something which is also needed right now more than ever as people continue to face the fears, anxieties, and other difficulties of COVID-19. COVID has also laid bare many of the disparities in access to healthcare that exist in our communities. My district, Virginia 10, is home to 4 of the 8 zip codes with the most COVID cases in Northern Virginia, and those are primarily in communities of color. So it's clear that we have work to do, but most important is that we don't go backwards. I'm looking forward to hearing from our guests here today who can share a bit about their personal experiences on how important the ACA is, give their perspective on how COVID has impacted Virginia's access to health care, and what else needs to be done to protect and expand healthcare here in the Commonwealth. So I'm going to toss it to my guests to take a moment to introduce themselves. Dr. Williams, let's start with you.
Good morning. Thank you so much, Congresswoman Wexton, for having me here today. As you said, I'm Dr. Anastasia Williams. I'm a pediatrician here in the Northern Virginia market at Novant UVA, and I also serve as medical director for pediatrics. I'm really excited to be a part of this discussion. So again, thank you for inviting me. As you mentioned, the pandemic has definitely exposed the disparities that we have in healthcare and the importance of access for all populations. So thank you again for having me, and I look forward to the discussion.
Thank you, Dr. Williams. Carol, if you want to take a moment and introduce yourself and tell us what you do at HealthWorks. Oh, and you need to unmute, sorry.
Right. Thank you again for inviting me to be part of this. I'm Carol Jameson. I am the CEO of HealthWorks for Northern Virginia. We are a federally qualified health center, also known as a community health center, and we have 4 health centers in Northern Virginia. And we take care of primarily very low income, often uninsured patients. And COVID has had a major impact upon us and our patients. As Dr. Williams said, definitely disparities within communities of color, communities that are low income and struggling every day, even without COVID in their lives. So I'm happy to be here and share some of our experiences with everyone.
Thank you, Carol. Tasha, if you want to tell us a little bit about how you came to be involved in starting Little Lobbyists and what your exposure is there. Oh, and I'm going to need you to unmute too. Perfect.
Hi, I did not start Little Lobbyists, but I have been an advocate with my family with them since the beginning. I live in Manassas with my husband and 4 children. I have a 1-year-old named Ian, twin 4-year-olds Finn and Octavia, and a 9-year-old named Jack. Little Lobbyists is a group that advocates for children with complex medical needs and disabilities. And my 9-year-old Jack takes great pride in being an advocate. He loves being a Boy Scout. He plays video games online with his friends, and he's an amazing big brother. Jack was born with a pre-existing condition called cystic fibrosis, CF for short. It affects most of his major organs, including his intestines, his pancreas, his liver, and his lungs. He takes over 50 pills a day and nebulizes medication and is hooked to a respiratory therapy vest for about 1 to 2 hours a day in order to reduce his disease symptoms and prolong his life. Access to his medications, therapies, and doctors is critical to his ability to survive and thrive. And I want to thank you for having me here with you today and being a champion for kids like Jack.
Well, thank you, Tasha, for being such an advocate. And it was great to get to know you and Jack and your whole family during my first term. And I'm proud to say that my very first official meeting on the Hill was with the Little Lobbyists. And it was fantastic when everybody came out back in the pre-COVID days when we could have everybody come. But thank you so much for joining us. Leslie, Dach, thank you very much for joining us. Last but not least, tell us a little bit about Protect Our Care and what you do for them.
Thank you. And thanks for all the work that you do and for all the work that our panelists do today. Little Lobbyists is an inspiration to all of us, and the parents and the children. And thank you, Congresswoman, for your leadership to bring Medicaid expansion into Virginia and to be such a strong voice for healthcare in the Congress and for helping the Congress pass and the House pass such important legislation on reducing the price of drugs and making healthcare more affordable for millions, legislation that we hope could become law next year. My name, as you said, is Leslie Dach. I'm the chair of Protect Our Care. It's an organization that we started right after the election in November 2016, when it became clear that healthcare was in grave jeopardy. Republicans had tried more than 60 times to repeal the Affordable Care Act, and now they, in 2017, had control of all 3 houses, both houses, and the White House, and began that journey again. And in a testament to the importance of the Affordable Care Act and to how much healthcare means in the lives of everyday Americans, because healthcare is a nonpartisan issue. It does not divide by party lines. It is a life and death issue. Americans spoke up and they spoke out, and as a result, repeal was stopped. But the law has been under threat every day since then, and we're working hard to stop that where we can, and just as importantly, to help this country take another important step forward in bringing affordable healthcare to more and more people. And my background in healthcare, before I started Protect Our Care, I was the senior counselor to the U.S. Secretary of Health and Human Services for the last years of the Obama administration. And there I served as the department's global Ebola coordinator, as well as having responsibility for large chunks of the Affordable Care Act, its implementation, and its politics. So thank you for having me.
Well, I'm glad to have you. And before you mute yourself, first questions to you, Leslie. Can you talk a little bit about California versus Texas, the case that's pending in the Supreme Court right now, because that's scheduled for oral arguments on November 10th, 1 week from the election. Can you talk a little bit about how that case has proceeded through the courts and what the issues are that are presented, and just a little bit about the procedural posture?
I will. I'd like to say I'm happy to, but that would be the wrong emotion for answering this question. As folks know, and as I mentioned earlier, the Affordable Care Act has been under attack for reasons that none of us can quite understand. They seem to be more ideological because the law itself is overwhelmingly popular, with over 60% of the American people supporting the law. But more importantly, things like protecting people with pre-existing conditions, lifetime caps, Medicaid expansion, being sure that women don't pay more for healthcare simply because of their gender, being sure that older Americans don't pay more for healthcare simply because of their age, are incredibly popular. 80 to 90% of Americans across all political parties support the things that the ACA does. And yet this is now the third effort in front of the Supreme Court to overturn the ACA. The first two failed 5-4. And 2 years ago, a set of Republican attorney generals and governors around the country
Leslie, I just lost your audio. I don't know if anybody else lost it, but.
Am I back?
You're back.
I don't know what's happening with me today.
I know. Technical difficulties. This is our life now.
I apologize to all the listeners. But I was saying that this is now the third effort in front of the Supreme Court to overturn the ACA. It began about 2 years ago when a group of Republican attorney generals and governors mounted a new attack when they said that the law was unconstitutional and needed to be completely thrown out because the individual mandate had been taken out of the law by Congress. Although at the same time, Congress reiterated its support for the rest of the law. They handpicked a judge in Texas. They then, that went then to a highly conservative appeals court in Texas, and now it's up before the Supreme Court. The president had a choice as to whether or not to defend the ACA, and he chose right before the 2018 elections to actually take the side of declaring the ACA unconstitutional. And here would be the implications, as I mentioned. If this case is successful, then as soon as the court reaches that decision, as soon as they decide and could decide, if they decide that the law is unconstitutional, all of its protections would be gone. And that means Medicaid expansion gone across the country for those individuals you mentioned in Virginia, but over 12 million people on Medicaid expansion across America. 135 million people with pre-existing conditions could lose their protections. And that includes everyone who has contracted COVID, which is now recognized, unfortunately, by insurance companies as a pre-existing condition. It would mean 23 million Americans overall would lose coverage at a time when so many, 60 million Americans have filed for unemployment and millions have lost their employer coverage. It would mean that whether you're on private insurance, your employer insurance, whether you're on the ACA, you would lose protection of those lifetime caps. And little lobbyists and who they represent would often leave the hospital with bills that basically meant they were over those caps and could no longer have health care. Women would be charged more than men simply because they were women. They would lose access to contraceptive care. And seniors could be over the age of 50, could be charged 5 times more than anyone else for their health insurance. And the donut hole would reopen and seniors would pay thousands more a year for their drugs. So these are catastrophic changes, particularly in the time of COVID.
And one of those 5 votes upholding the Affordable Care Act was Justice Ruth Bader Ginsburg, who has since passed away. And now Republicans in the Senate are rushing to get a new nominee through. And there's a real danger that vote could go the other way now, and that would not enable a rehearing. If it were 4-4, what would happen if it were a 4-4 decision, and what would ultimately be the practical effect of that?
Yeah, well, the first thing, obviously, as you just said, Republicans on the Judiciary Committee, and that unfortunate drama is unfolding as we speak, claim they have the votes to appoint Judge Barrett to be Justice Barrett, and in an unprecedented way are moving this nomination forward when people are already voting. Everybody on this call has seen the lines in Virginia. People are already voting in America. And there's an overwhelming consensus amongst the American people that the next president and the next Senate should be the ones who decide the next justice. But unfortunately, Senate Republicans are seeing this a different way. And at a time when COVID's in the White House, when COVID's in the Senate, when we're seeing spikes all across this country and unprecedented hospitalizations and rates in many states, Republicans are still refusing to even negotiate, much less pass a COVID relief bill. Congresswoman, as you know best, the House passed a comprehensive multi-trillion-dollar bill a number of months ago, and yet it's languished in the graveyard in the Senate. So they don't have time to help the American people's health or to help them with their economic concerns, but they do have time to rush this Supreme Court justice through. And this is a judge who has twice written in support of the unconstitutionality of the ACA. She disagreed with both Supreme Court cases that favored the ACA. And the president has said repeatedly, both in tweets and in public, that he's only picking judges to be justices who he believes pass the litmus test of voting against the ACA. So Americans have every reason to worry that a week after Election Day, when the court hears this case, that the votes will be there to declare the ACA null and void. Now, when we hear about the decision, we don't know. But if it is a decision to rule the law unconstitutional, that will take effect immediately when the lawsuit decision is made public.
Thank you, Leslie. And Tasha, can you speak briefly about why the ACA is so important to your family and other families of children with complex medical needs and disabilities?
Yeah, absolutely. I think something that's really important for everyone to understand is exactly what a pre-existing condition is. So a pre-existing condition, it seems like this political buzzword or hot button these days, but what it really truly is anything you see your doctor for that they bill your insurance for. And prior to the ACA, who decided which pre-existing conditions got covered and which didn't? The insurance companies did. So that's really important to know as part of this conversation. And the other thing that's important to know is that when you hear people talking about they're displeased with the cost of Obamacare or the healthcare exchanges, often they don't realize that's just one small part of the law as a whole. There are 4 things that exist in the law that no American wants to see overturned, especially not families like mine. That is, it got rid of pre-existing condition exclusions. Insurance companies couldn't say, I won't cover you because you have a pre-existing condition. It ended lifetime caps, which I'll talk a little bit more about in a second. Lifetime caps is when your care became so expensive, the insurance company could drop you from your plan and no longer insure you. It allowed children to stay on insurance until age 26, and it expanded Medicaid. Those 4 pillars are the foundation of the Affordable Care Act, and something every single American has come to rely on, especially like families like mine who've been fighting tirelessly to keep this intact. How it affects my family specifically, I'll touch on cystic fibrosis is a pre-existing condition. So should my husband lose his job, we could lose our insurance and not be able to afford the things my son needs to survive and thrive. Something that's really on my mind is lifetime caps. And how lifetime caps work is prior to the ACA, they were usually $1 to $2 million. Once you hit that $1 million in claims, your insurance company could drop you and you were no longer insurable, meaning no other company would pick you up either. And there's this belief out there that kids with rare diseases or expensive diagnoses automatically qualify for Medicaid. And that's not true. My family makes just enough that we don't qualify for Medicaid, and we rely solely on our employer-based healthcare plan to pay for Jack's medications. And now I'll tell you why I can't afford those medications without insurance. From January 1st to today, Jack's insurance bill was billed for just medicine, $368,949 for 10 months of medicine. That does not include doctor's visits, hospital stays, therapies, or any of the other care that he needs to live. His medicines help him perform the basic functions of eating and breathing. Mm-hmm. And if we lose our insurance the day the ACA gets overturned, he cannot get those medications that help him actually live his life. In addition to that, in the last 9 years, he's met his lifetime cap multiple times over, as I'm sure you can imagine. And the only thing that has kept him insured is the Affordable Care Act. So if the ACA were turned over today and they didn't count our previous hitting of that lifetime max against us. By the age of 12, my son would be uninsurable for life.
Mm-hmm.
With the disease that costs $500,000 a year in just medication alone.
Yep. And I know that you're not alone. I mean, a lot of the parents in the Little Lobbyists were saying that their kids, some of their children would have met their lifetime cap before they ever went home from the hospital. Born.
Yes. The youngest children to meet lifetime caps are most often preemie or NICU babies that are born earlier and earlier, and with advances in medicine are able to be saved with state-of-the-art care that cost millions of dollars. When you're in the hospital for a year, you hit your cap.
Oh, sure.
And you're only a year old, and now you are uninsurable.
Yeah. So what has Dr. Williams and Carol tell the ACA has hospitals, health centers, patients of the people that you all serve and what it has done for you? Dr. Williams, with you.
Yes, first of all, thank you, Leslie and Tasha, for your advocacy. If there's ever a time that we've needed it, as you all mentioned, now is the time. Tasha, I actually learned about lifetime caps from a family in my practice that has 3 children with cystic fibrosis. They don't teach us those types of things in medical school. What we learn is how to provide the best care for our patients, and there's no sticker tag on that, right? And then when you get out into practice, it is so difficult to be able to focus on providing the best care we can for our patients, like the care that our president received when he was diagnosed with COVID, to be able to provide that kind of care for our garden variety patient. And I'll never, ever forget when we were talking about what we were going to do for this particular patient who had cystic fibrosis. The mom was like, but wait a minute. How's that going to affect my lifetime cap? We can't afford that. Not only did we have to worry about the out-of-pocket expense, so the copay, right? We also had to worry about the actual cost that the insurance company was going to pay. It blew my mind, and because of that, family, that's where I learned the importance of getting rid of things like lifetime caps. It took a tremendous amount of pressure off of my families that have chronic medical illnesses. So thank you, Tasha, for what you're doing. And thank you, Leslie, for clarifying for us the importance of the Affordable Care Act. As far as the ACA and how it affects my practice, that's just one example in being able to deliver quality of care. Certainly, I do feel like the Affordable Care Act was just a beginning. It was a first step towards a goal. It was not intended to be the end answer. And that first step was increasing access for patients in the community, for people to be able to get the care they could deliver it. Unfortunately, for those of us who are in the process of making the expenses to provide that care, there's definitely a challenge in being able to provide that access to people when the cost of medication and supplies continue to skyrocket while we decrease the cost for people to enter. So it's made it very difficult for independent practices to survive, including mine. It was especially felt in Virginia because while the first couple of years of the initial Affordable Care Act did expand Medicaid, the initial composition of our Virginia Congress did not continue that. It came back, but it came back in a different way. But thank you, Congresswoman Wexton. But what that means for me as a pediatrician is that what the funds that we are expected to provide care were again dropped after we were becoming more accustomed to being able to almost meet the expenses, but the expense of care continue to rise. Certainly, I love where I work now. I ended up selling my practice that I had for 15 years because of that stress. And I love that I can get up and provide excellent care and not be so worried about it. But certainly, again, even for larger healthcare systems, we've got to get a hold of the cost of medication. I have asthma, and for my asthma, I take an inhaled steroid that I take to make sure that I stay healthy and I don't get sick. I was shocked when I went to pick up my prescription for my inhaled steroid, because normally I would get it normally cost me about $50. And I went to the pharmacist and they told me that the cost after insurance was $150. And I was like, well, what do you mean $150 for one inhaler that's supposed to last me 24 days, not even 30 days? So I was like, well, what is the cost of the medication? He said $1,010 was the actual cost. And the break was $150. Certainly, I still think that's expensive as a physician. But I know when my doctor prescribed that medication, I know when I prescribed that medication, I'm not thinking about, the cost per se. We have all had to learn to work with all these different insurances and figure out the cost to deliver the care. But that really is not acceptable, because we know it does not cost $1,010 to make this medication. How could that? That's impossible. So the ACA was just a start. I'm done.
And we have a plan for that in the House, Dr. Williams. HR 3, Elijah Cummings Lower Drug Costs Now Act, which passed through the House, but is languishing in the Senate. So yes, so we recognize that more needs to be done. But thank you, Carol. How about you? How has the ACA impacted HealthWorks and other community federally qualified health clinics?
Well, it has just been a wonderful, wonderful program for our patients. We provide comprehensive primary care, dental care, and behavioral health services. And the vast majority of our adult patients and a large number of our pediatric patients come in with chronic illness. So that pre-existing clause right there is a total game changer. In addition, one of our greatest challenges with our patients, they are very poor. They don't have jobs often that have sick leave and benefits. So they really struggle to make ends meet on a day-to-day basis. They are often, we provide care whether folks can afford it or not. We waive the fees if they cannot afford it. But nevertheless, folks are often reluctant to come in for care if it means they're going to miss work and lose wages for that day. So having insurance has given them peace of mind. It's also expanded their access to specialty care. While FQHCs are wonderful. We were founded in the 1960s, and I'm not embarrassed to say we are just amazing. But we are not specialty care. We have GYN and psychiatry on our staff, and that's it. Without insurance, accessing specialty care for our patients is really case by case, specialist by specialist. We have wonderful partners, but it's not just a quick phone call. The last thing I'll say, which is sometimes forgotten, is the other thing that has come about. We have dedicated certified staff who've helped patients enroll in ACA and Medicaid. And what comes along with that is help with health literacy, learning how to use insurance. Access to health care is wonderful, but you also have sometimes to learn how to utilize healthcare. Not everyone knows how to do that. And so folks who have insurance and have supports, many of the insurance companies have case managers, et cetera, who help folks learn how to navigate. Try explaining copay, deductible, all of that to most of us. We're all still struggling with that. People that have never had insurance, it's a real climb for them. Learning how to use health insurance means it's then utilized, healthcare is utilized, and people are healthier. They make use of the preventive care that comes without any charge. They learn how to manage. They become wise healthcare consumers. And I think if you were to do an analysis, maybe Leslie and his group have done this, if you were to do an analysis of cost, I think you would find that the ACA in the long run has saved enormous dollars that would have been spent on preventable hospitalizations, missed work, unemployment claims, etc. So Leslie, if you haven't done that, maybe there's a thought.
Excellent point, Carol. And that's one of the things that I remember when we were talking about, when we were having the Medicaid expansion debate in Virginia, about the fact that, you know, people who, if you don't encourage people to get the care, you know, the preventive care or the care for their chronic conditions, then they're going to end up in the emergency room, which is the least efficient and most expensive and least effective way to provide care for people in the community. So you definitely want to encourage people to get that preventive care, especially because so many chronic conditions are the top drivers of healthcare expenses in our country. So absolutely, thank you. Now, COVID-19 obviously is the top issue when it comes to healthcare at this moment, and the fact that the Trump administration is trying to strike down the ACA in its entirety in the middle of a global pandemic is obviously concerning. But I guess the question that I have for you, Tasha, is how has COVID impacted your family in terms of the special needs that your son has, and how you guys have to take extra precautions?
We went into our, what I call medical isolation, on March 6th, nearly a full week before the rest of our area. My family's from Seattle, so I saw what was happening there, and I called Johns Hopkins and said, hey, this is going on. What do we need to do? I pulled Jack out of school immediately, and we came into our home. At the time, there was no mask mandate, so I had to go get groceries for my family. We tried really hard not to go at all. We had friends delivering things to us. But there were things I needed to get for Jack that a typical person would not know how to get. And I wore a mask to the store, and I was shamed in the store. People were rude. They made fun of me and treated me like I was insane for trying to keep my baby safe. Until the mask mandate passed, we had to wash all of our groceries before they came into the house, because anybody who'd been shopping in the grocery store could be spreading infection, and we could bring it into our home. And I have 4-year-olds with grubby little hands that know how to open a fridge. So we didn't have a choice. We had to clean everything. Everything that came into this house got disinfected. The mask mandate helped incredibly. I no longer, so long as that stands, we don't have to wash all of our groceries all the time, because the likelihood that there's infection on the groceries is less. Something all Little Lobbyist families are facing right now is a lot of the same challenges as other families. But the thing that is different is that when schools open, we don't just get to go. We don't get to go back to school or back to work or back into the normal life when somebody deems it safe to go there, because it's not safe for us until there is a vaccine that is not only in existence, but has been used widespread. So we are in this for the long haul. Until it is truly safe for our family to be out, we are in our home.
So that's something I hadn't really thought about, because kids with complex medical needs would probably make that first tranche, that first group of people to receive the vaccine. But if others don't, and it hasn't reached that critical mass in the community, then I'm sure you don't want to take any chances.
Exactly. And we all know that viruses mutate. That's why there's different strains of vaccines for different flus every single year. So it's something that we're all going to have to be very well versed in going forward, to make sure that we are making the best choices to keep our children safe and make sure that they don't succumb to COVID.
Thank you. And one of the things that we've seen with COVID-19 is that it has revealed some longstanding health inequities in our community. And it's definitely impacting communities of color, especially Black and Latino communities, with greater effect than it is in the white community. Much greater infection numbers, hospitalization rates higher, and the outcomes are also more severe. So Dr. Williams and Carol, what are some of the health disparities that you have witnessed in treating individuals with COVID? Carol, we'll start with you on this one.
Well, I would say the greatest disparity that we have seen, it's really connected with the really what we call social determinants of health. So many of you have probably heard of that term. Basically, we're saying you can have healthcare right here, but if you don't have stable housing, if you don't have transportation to your healthcare provider, if you don't have language or ability to access care in your language, that can be a barrier. So with COVID, we started doing COVID testing on March 12th, and we do COVID testing throughout our centers. So we had to retrofit our centers. We had to put all kinds of fancy plexiglass. The plexiglass industry is booming, good for them. And what we have found is that among our population, which is the folks that we serve are about 78% Latinx right now, that is where the infection rate is the highest. But if you dig deeper, it's really about their poverty. It's really about the fact that they live in overcrowded conditions. It's really about the fact that many of them have jobs, as I mentioned earlier, that do not have benefits. So they must go to work. And so their ability to quarantine if they're found to be positive or when they're awaiting a test is severely impacted. And as more people have been tested and found positive, the community has learned that there is a severe economic impact from the need to stay safe and keep your family safe and your community safe, but meanwhile, you run out of money. And there's a direct line between poverty is such an enormous impact. If you look at who is at most risk for COVID, who's contracting COVID, who often lacks the ability to take safe measures to prevent getting COVID or exposed to COVID, and then the very, very difficult choices that families and individuals have to make about COVID testing itself and whether to even undertake that quarantine. Now, in Northern Virginia, both Loudoun and Fairfax, where we have centers, have taken very innovative steps to try to support families, to try to address that economic impact. But it is still a very real thing. The other thing I will add is the stigma. I can see by my gray hair, I'm not young. I started out my work in health access. I'm a social worker in HIV/AIDS in the 80s. And that's what started my passion for access to health care. We're seeing some of that same stigma now, the stories. We call it the capital C, myths, stigma attached. If you're being tested, you must be positive. Those sorts of stories. We know of people losing their homes. Poor people often don't have not all poor people, but many of our patients don't have a real lease. They have sort of an agreement. People have lost their housing because they were tested for COVID, never mind whether they're positive or not. So you kind of go back to the poverty, and then you go back to persons who have a different culture, a different language, often discrimination, stigma. People want to find sometimes someone to blame. So all of that has a part to play as we're trying to serve our patients, get them tested, get them healthy, protect them, and make sure they have the support for those social determinants to get them through this time. I'm a little passionate about this, as you can tell, because it is so every day, every single day, our communities are just struggling. These folks that work so hard and don't have the luxuries that many of us do have to weather this in a less frightful way.
Right.
I'll let Dr. Williams speak now.
Well, yes, and you're absolutely right, because most of these folks, you know, do not have the benefits can't telework just because of the nature of their jobs, and they all work frontline jobs where they have that constant contact with others. So yeah, you're absolutely right. Dr. Williams, what are you seeing disparities, and what is Novant Health doing with outreach to the community to ensure that people know that it's safe to come out and get their treatment and their test?
Thank you. First, I want to say I agree 100% with Carol. She is absolutely right that a lot of the disparities that we see delivering healthcare, particularly in this COVID season, really are based on the social determinants of health and poverty. Being part of Novant, I have the privilege of taking care of patients in every stratosphere, from pretty wealthy to struggling. And one of the saddest and most difficult things about this season is that healthcare / COVID has become a political issue. And that has made it extremely difficult, because in order for us to be successful, to get kids back out to school, to get families really the support they need so that they can move forward, we have to have buy-in from everyone in the community. It's not going to work if only the people who are actually being affected by COVID in our Northern Virginia area, the people who live in overcrowding conditions, the people who have those jobs where they're out front, where they don't have the luxury to take time off or to work from home because they have to deliver the mail. They have to go out and cut the grass. They have to go out and work in the supermarket. Their children are in a very different situation from the families that I take care of that live on acres of land. They're out in Culpeper. They're not overcrowded. There's like 4 people in 3,000 square feet of housing. And unfortunately, they just think it's not a big issue. They're like, it's not that bad out there. It's a hoax. It's not an issue till it affects them. More than anything, we really need to all get the politics out of this and bring back empathy, which would help to bring back trust. As far as Novant, we have gone out of our way to make sure that our facilities and the care that we deliver is quality care in a safe manner. All of us in all of our professions have had to learn to be adaptable, flexible, creative. So we're doing a lot of this, video visits, for those patients that we decide is best for them not to come into the office because we don't want to be exposed, right? Because we have to keep our staff safe and we don't want our patients to be exposed. The idea of using a waiting room in pediatrics, for now, that's gone. And it may be our new normal. I talk like that. I'm not talking for nobody, but from a pediatric standpoint, kids play, kids touch, little kids put things in their mouths. So guess what? It's so much better to have them wait in their car and give us a call. And we'll call you when we're ready for you to come into the office to our beautifully clean exam rooms, especially ready for you. So we've really gone out of our way. And it's not just our pediatric practices, but also our facilities at the hospital, whether it's for x-ray, the ER, PPE, we've made it readily available to our staff. Everyone knows what PPE is now. So masks and hand washing and all those things to keep the staff safe and to keep our patients safe. And we also provide it for patients when it's necessary. So the worst thing to do right now is to not get the health care that you need. From a pediatric standpoint, we found that a lot of patients have put vaccinations on the back burner because they don't want to get COVID or they don't want their kids to get COVID. But guess what? COVID actually for children, most children do not get as sick. Most of them are asymptomatic. Now, that does not mean that they can't take it home and give it to grandma or to give it to someone else who has a more vulnerable immune system, like a child with cystic fibrosis or an ex-preemie with chronic lung disease. But you're better off getting that child vaccinated for things like, the measles, the mumps, diphtheria, things that we don't want to come back that can really affect children because they're much more readily able to spread and contract these diseases. So get your kids vaccinated. I had to throw that in there.
Of course. No, you're absolutely right. You're absolutely right. And get your flu shot too while you're at it. So
yes, flu shot.
So I want to back up and talk a little bit more about the ACA and this case to overturn it. Leslie, you know, if the ACA is, God forbid, if it is overturned, would states play a role in bringing in protecting care? What would happen to the people who got Medicaid expanded in Virginia? And are there things that the state can do above and beyond what the ACA did to protect their citizens?
Well, yes, they can, but it will take time, of course. And there are many states that simply don't have the political will to do the job or the economic resources to pay for it, because not only will, when Medicaid expansion goes away, it's not just the program, it's all the federal dollars that come back to a state like Virginia to pay for it. So at a time of COVID, when state budgets are so stressed already, the idea that all of a sudden we can count on states to also foot the bill for the healthcare that their citizens need, I think is far-fetched. And we're seeing that, already today in the school systems, as people have discussed, and in testing, because the Senate of the United States and the president have refused to negotiate and pass a COVID relief bill, schools can't afford to keep their kids safe. The workers have to make a hard choice between going to work and staying safe. So we need not only the ACA, but these additional federal dollars and programs. We can have an effective national testing program unless the federal government does its job. So, the ACA can be somewhat replicated by the states, but there will be many, many things that can't be done at the state level. No one should count on even the most bluest or the most progressive or the most health conscious of states to substitute.
Well, and then
for this
even in the
law.
best case scenario, you'd end up with this patchwork of 50 states, each with their own laws and requirements and protections. But that's an excellent point that at a time when states are so cash strapped, it's going to be very, very difficult for them to do anything over and above what they are absolutely mandated to do, without having to cut somewhere else. So that's an excellent point. Well, I guess the final question I have for everybody is, what can Congress do to help alleviate some of the impacts you're feeling in COVID, and to help shore up the ACA as best that we can? Leslie, we'll start with you.
Yeah. Well, first, next year we hope that we'll have an opportunity for Congress not just to discuss but to pass and turn into law things that will build on the ACA to make the law better. At a time when healthcare and the impact of COVID on the economy are so paramount, it's time for us to move forwards and not backwards. And the House of Representatives, as you mentioned, has passed aggressive and historic legislation to reduce the cost of drugs for everyone by allowing Medicare to negotiate for lower prices and to pass those savings on to people in the private insurance market as well. You've passed a bill to make healthcare far more affordable by increasing the financial assistance for people, by taking a number of other measures to make sure that people can afford their healthcare and afford their healthcare insurance. We need to pass those again. The Senate needs to pass them. And then we need to move beyond that into a public option and expanding Medicaid throughout the country. At the same time, we need to pass this COVID bill. And that means we need to provide money back to the states. We need a national testing strategy. We need money to keep our schools safe. And we need support for our frontline workers. There is so much that needs to be done at the federal level that the country simply can't wait for. But unfortunately, and I'm not trying to be political here, just the reality is that we will not see those things done under the leadership we have now because they've opposed them. So we need new leadership just factually to address the issues we've discussed.
Thank you, Leslie. And I absolutely agree. I mean, having a situation where you have 50 states, each with their own plans and each with their own agendas, is not a recipe for a successful COVID national response. So to the rest of the group, what would you like to see Congress do to help combat COVID and hopefully protect some of the most vulnerable among us? Tasha, we'll start with you.
We need increased funding for home and community-based services so people can remain independent. We need increased funding for special education services. We need access to a 90-day supply of our medications at all times. I have a medication of Jack's. I can only get 28 days at a time of that medication because it's $29,000 a month. So if I can't stock up on that and we have a mail crisis or we have a natural disaster or anything else, that medicine helps him breathe, right? So families of kids with disabilities need access to things like medications and medical supplies in a greater amount at a time. And right now, the insurance companies dictate the quantity that we can get for medication.
That is an excellent point. I had not even thought about that aspect of it, but especially with everything that was going on with the Postal Service when there were delays and everything, and there was some real question about whether things would be timely delivered. I know that a lot of people who depended on their medication through, for example, the VA had that problem, but at least with the VA, they are able to get medication for a longer duration. So.
Yeah, and with a lot of these medications, the high cost medications for rare disease and chronic illness, you have to get the mail order because there's only 1 or 2 pharmacies in the country that carry them. So I can't just walk over to Walgreens and pick up what Jack needs. They don't have it. So that's really is key to a lot.
And I absolutely agree with you about the funding for home-based services because anytime you can care for someone in their home and keep them independent, it's better for everybody, and ultimately it's less expensive for everybody in the long run. But it's just you're going to get a better outcome that way, and that's the case for seniors, and that's the case for kids. So absolutely, I agree with you on that. And same thing with the special ed. You know, the federal government has never, not once, funded the IDEA up to our aspirational goal, or even close to it. So that's something that I would love to see us pick up more of the tab on to help our states and to help those kids. So thank you. Excellent suggestions. Dr. Williams, what would you like to see us do? If you have your wish list.
Yes, 4 things. Some of it is redundant. The first is make sure that there's provisions for childcare. I'm alarmed when I hear families say they want their kids to go back to school no matter what because they have no childcare. Because what I hear is if your child is sick, they're going to school. You're not going to tell people they're sick because you need to go to work. And like I said, that's not going to make us effective in trying to really get a hand on what's going on in our community with this disease. So provision for childcare. And that's not just for those who can't afford it, but even those of us who are working from home, telecommuting. My husband gets to telecommute for his job. I telecommute sometimes. I don't have small children at home now, but I have patients where they have 3 kids all doing school online and the parents are doing work online. And it's very stressful for the families. The second thing is funding for PPE in schools. I think one of the biggest drivers right now for schools being challenged, public schools particularly, with regards to being able to open up is teachers feeling safe. We got to make sure that the teachers have what they need to feel safe to go back in those classrooms. Because as much as we want kids to go back to school, if the teachers are not there, it's not going to work. So I think funding for PPE, good PPE, like many of the private schools have been able to do, would help. The third thing is a clear protocol and a matrix that schools can follow to make decisions about whether or not they should open up or close. I think my husband is chairman of the school board here in the city of Manassas, and I see him struggling with looking at all the parameters to see where Manassas is, where we have really one of the highest positivity rates for COVID in our Northern Virginia market compared to Prince William County. And to be able to make a decision so that people don't think it's just political, it's not just about me, myself, and I, childcare for them. Okay, I can talk, but basically a clear protocol and matrix for schools to use. And the last thing is a federal plan. This whole thing with each man for himself, each state for himself, figure it out on your own, This does not work. It has been very clear that having strong leadership and direction from the top that takes everyone's health and care into concern and is empathetic and provides support to all families is the most effective plan to have to successfully keep the economy going, to get schools opened, and to keep us moving along. We need clear leadership from the top down. Thank you.
Thank you, Dr. Williams. Excellent, excellent suggestions all. And I absolutely agree with every single one of them, and we'll see what we can do. But I appreciate your emphasis on decoupling the political from the public health, because they really should not be at all connected, you know? So thank you. Thank you. And Carol, how about you? Is there anything left that you want to talk about?
Well, my very long list too. I think I would choose medications, access to medications. I think, Congresswoman, you're aware of the 340B challenges that the community health centers are facing now. I won't get into that extremely weedy technical subject, but people often say to me, well, no one would die in this country without access to health care. And I say, well, if they get hit by a car, they probably won't, because they'll go to the hospital and they'll get emergency care and there's charity care. But people die all of the time because they don't have access to appropriate treatment for their chronic illness or sometimes even their acute illness. It is totally incomprehensible to me that in the midst of a pandemic, we would not have a process, a system in place that would go the opposite of where we're going, which is to say, you need your medications so you can stay healthy from your diabetes or your kidney disease or your cardiac disease or your pediatric asthma or your pediatric diabetes. No, we're going to make it harder for you to get medications. Now, whether scientifically people are more susceptible to COVID if their chronic disease is not well controlled, Dr. Williams could answer that. I don't know if there is a clear correlation, but it makes no sense to me that in the midst of this, we continue to have such a struggle to access life-saving, absolutely required medications. If we think about where we were before antibiotics, you think about people who died from simple infections. These medications have the ability to enable people not only to stay alive, but to take care of their children, to go to work, to be part of their communities. It seems so straightforward and simple to me that we would have a dialogue that said, no matter what, we will make sure that people have access to the medications that they need. So this is not just a COVID response, it is a long-term conversation. But for me, in the middle of COVID, it just seems so very essential that this continue to be on the table.
Absolutely. And COVID has really helped to shine a light on just how important this is and how much it affects people all across the spectrum. But even before COVID and even after COVID, you know, this is something that we need to deal with at the national level. Affordable health care is one of the top things I hear about from my constituents, bar none, you know, both when I was in the state Senate and now as a member of Congress. So I will keep fighting for these issues. You know, I hope that everything turns out okay with the ACA, but if it doesn't, I will be here to help pick up the pieces and hopefully work to protect and expand our healthcare access from this point forward. I want to thank our guests for joining us. This has been hugely informative, and thank you so much for sharing your stories and your passion and caring for others and ensuring that everyone has affordable, quality health care and that you're taking care of the most vulnerable in our community. So I just want to say thank you so much for joining us, and I will be here and I've got your back. I'm going to keep fighting for you from this point forward. Thank you so much.
Thank
Take care.
you.